This is deadline day for the Obamacare website do-over. After a disastrous rollout that caused online headaches for so many Americans trying to buy health care coverage, the administration says today's the day the site will work for most users. So will it? We'll have a live report. And even if the site does work after a stream of missteps and missed deadlines, will it be too little too late? I'm Doug McElway in for Uma Pemberaju. One of Obamacare's harshest critics, Republican Congresswoman Marsha Blackburn, is standing by. But first, let's go to Chief Washington correspondent James Rosen.
Doug, good afternoon. For President Obama, today's semi-official relaunch of Obamacare 2.0 could prove a decisive point in his presidency. The latest Fox News poll, conducted just before November 14, when Mr. Obama issued that hour-long mea culpa for the disastrous rollout of his signature law, that poll found a record high 55% of registered voters disapproving of the chief executive's job performance. 4 in 10 approved, and 5% said they didn't know enough to form an opinion. Of the president's oft-repeated promise, if you like your health plan, you can keep it, fully half of all registered voters now believe Mr. Obama knowingly lied when he offered those assurances. 4 in 10 believe he didn't know that promise would turn out to be untrue. Only 1% think he was exaggerating, and 10% don't know what to think. And of the president's apology, 38% of registered voters regard it as sincere, but 58%, nearly 6 in 10, believe it was proffered for political reasons. With the First Lady by his side, the president sat this week for that excruciating exercise, which has been described elsewhere as a kind of theater of national revenge, known as the Barbara Walters interview, wherein Mr. Obama was confronted with the fact, as Walters put it, people just don't think you're trustworthy.
I got reelected in part because people did think I was trustworthy and they knew I was working on their behalf. I think the bottom line is, Barbara, that I don't know any president who hasn't gone through certain periods during their presidency.
It's a hard job. I am fortunate to be living with a man who has a long view of this job, who understands that in the case of health care, that this is all about the folks who don't have insurance, the folks that he sees every single day.
Very rarely the president added in that interview to the things that happen, that work well, get the same attention as the things that aren't working well. Doug?
James Rosen, thank you very much. And here to weigh in now on the website and Obamacare in general, Republican Congresswoman Marsha Blackburn of Tennessee. Congresswoman, thank you very much for joining us.
Good to be with you. Thank you. I'd
like to start with a quote from the Washington Post. I think it was posted at 12:01 just after midnight tonight. It reads, quoting, "Administration officials are preparing to announce Sunday, tomorrow, that they have met their Saturday deadline for improving healthcare.gov, according to government officials, in part by expanding the site's capacity so that it can handle 50,000 users at once." It may be a bit premature, but what are you hearing, if anything, at this point?
Well, what we know is that in order to try to meet an adjusted deadline with reset expectations, what they've done is to say, okay, the small business, the shop, is not going to work, so we're taking that out of the picture and delaying that. The payment process for our insurers, sending those subsidy dollars to insurers, that's not going to work. We're going to manually do that. So now what is left, let's look at making this website work for most users. And the expectation is for about 80% of those that go to the website that it should work. But you know, you got to look at the fact that they did take it down again for another 11 hours, and I understand this morning it is sporadic as to whether it is working or not working when people are logging on.
And I guess that will become clearer and clearer as the day progresses, so we'll be watching that. How important politically for the Obama administration is this relaunch?
I think that it is very important because what they have done was to reset the expectations so many different times. They've missed half their legal deadlines. They've had 22 delays. They've given 1,700 waivers, and people are saying, wait a minute, this is not the way it was supposed to be. And Doug, one of the things you have to remember is that on October 1, when they launched this, you didn't see an Obamacare situation room with President and Mrs. Obama being enrollees number 1 and 2. You didn't see HHS officials, IRS officials choosing to opt into the system. And so what people are looking at is, first of all, a website that didn't work with the expectation that the delivery system is not going to work. They're hearing from their health insurers that costs are going up and from their doctors that they're no longer going to be a part of the network that those insurers are making available. So it is not about insurance to 30 million people that didn't have it. What it's turned out to be is a takeover of 1/6 of the nation's economy, which is the healthcare system, and the limiting of options for individuals and the capturing of those options by the federal government so that they can dictate or redistribute who gets access to what kind of health care in different areas in the country.
Well, on the subject of redistribution, our Jim Angle reported last night on Special Report that one consulting firm estimates that the number of Medicaid recipients is absolutely blossoming under this plan. I think the number was 800,000 people already enrolled in Medicaid, 142,000 people paying in the exchanges. So it's almost like a 4-to-1 ratio. And we're expecting millions upon millions more Americans to enroll in Medicaid in the coming months. Is that kind of a de facto form of single payer?
Well, in essence, it is. And there is tremendous concern. And I have to tell you, whether it's been at the grocery store, the ball game, church, or the music concert, when I'm out and about during this Thanksgiving holiday and period and working in my community, I am hearing from healthcare providers, from hospitals, I am hearing from insurance companies. Everyone is very concerned about this, the escalation in the Medicaid enrollees and the fewer number of those that are opting to purchase or make a purchase into insurance. And it also highlights the need for verification.
Real quick,
and making certain that those that are getting subsidies.
We're basically out of time. What is the Republican strategy in the face of Obamacare over the next several months? Is it wise just to sit back and watch it unfold?
Our strategy is solving problems. That is why we have the American Health Care Reform Act. That's why we're continuing to push for delaying all of Obamacare, and it's why we want to push for a cross-state line purchase of health insurance so you control your health care decisions and dollars.
Congresswoman Marsha Blackburn from Tennessee, thank you very much for your time, ma'am. Good to talk to you.
Thank you.